Hi, Giuseppina. Thank you so much for joining me today. I'm really excited to be with you on HPV Awareness Day.
Hi.
Tell everybody who's watching a little bit about yourself.
Hi. Yeah, my name is Giuseppina Caravella, and I work at Stony Brook Cancer Center. And my background is public health. I have my master's degree in public health, and I work in community outreach and engagement. So I'm a certified health educator. I go out into the community and I educate about cancer screenings and prevention.
Amazing. And I'm Dr. Stacy De-Lin. I am a physician and I am the Associate Medical Director at Planned Parenthood Hudson Peconic. And I'm so glad you're with us today just to talk about on HPV Awareness Day what HPV is. So, since you do so much community outreach, how do you explain HPV to your patients?
Yeah, so when I talk to the community and I talk about HPV, it's a big one that we talk about because it has a lot to do with cancer, actually. So HPV is a virus. It stands for the human papillomavirus, and it's actually a very common virus. They say over 80% of folks will come into contact with this virus at some point in their lifetime. So you could kind of think of it as like the common cold. It's out there, everyone's kind of gonna catch it at some point, right? But it's important to note that there's a lot of different types of HPV. So, I feel like in the past couple of years, we've all learned a lot about viruses. So, there's different strains, so to speak, right? And some of those strains could go on to cause cancer later on in life. Some of those strains will catch, will clear, we'll never know we had them. And some of those strains we will know that we have because unfortunately they cause genital warts. So you would see the warts and you would know that you have, those strains of HPV. So HPV is kind of an umbrella term for all these different viruses. But when we talk about cancer prevention, we kind of focus a little bit more.
Yeah, and in my setting, we typically see the higher risk type of HPV. In addition to seeing the low risk type genital warts, we also see the high risk type via people's pap smears, and that's when people are first exposed to the idea that they might even have HPV. It comes back on their pap smear that they have this infection, and it's really interesting. In my setting, people think a lot of it of like as a sexually transmitted infection, and get very concerned, like, how did I get this? Do I need to like notify a partner? We have all those questions, but it's like you said, it's like a common cold. Everyone has been exposed to it. Some people's immune systems clear it, some people's it doesn't, and we don't really know why that happens, but we start to worry about it when it causes changes on your pap smears, and that those changes can lead to cervical cancer. And in addition, it can cause cancers in a lot of other parts of the bodies. We see like oral and throat cancers, rectal cancers. You can see penile cancers, and so it's about sort of detection and we how is it that you talk to your patients about detection for these kind of for this infection?
Yeah, so as you had mentioned, HPV can cause a number of different cancers. So HPV likes to live in these different areas of the body. And unfortunately, screening is not routinely available for most of these
Right.
areas, right? So you name the cervix, which is one of the places we can kind of win with HPV a little bit because
Mhm.
we do have a screening, and that is your traditional pap smear, HPV test. Sometimes they go together. Folks can talk to their provider about exactly what type of test is being done. But another option is an anal screening, which would be an anal pap or an anal HPV test. It's important, though, to note that those are not routinely recommended, and so insurance coverage might be spotty. I really think that that's an important conversation to have with your provider. Um, but that's only two of six sites. And you had mentioned throat, and I think it's important to note that throat cancers and oropharyngeal cancers are actually the most common HPV cancers that we see today in our part of the world. And folks might think like, oh, I go to the dentist, they check. They can't check for this kind of cancer. Unfortunately, it's not until it's more advanced. That you start to feel and see the protrusion that you would even know that it's there. So there is no screening when we're
Right.
talking about these other sites. And I think that's why we love to focus on prevention.
Yeah, absolutely. Yeah, that's why we're here today to talk about prevention. I think with HPV awareness, that's what we do want to know since we're limited in how we can screen in various parts of the body. I think that's why it's so important to talk about vaccination. And so hopefully by now most folks have heard about Gardasil. That's the brand name for the HPV vaccine. And, it is incredible and that it's actually a vaccine that we have that prevents cancer. And that's really, really unique. We also have Hep B, which can prevent liver cancer, that vaccine. But overall, we've been using it for a while and we've been able to watch cervical cancer rates and other cancers just plummet with use of this vaccine. And it's just, I think of it as just an absolutely like revolutionary miracle that we have a medicine, that we have a tool that we can use to help prevent these cancers. How is it that you're talking about to your patients about when's the right time to get the HPV vaccine?
Right. So, yeah, like you said, it's pretty much a no-brainer, right? It's a vaccine. We're preventing 6 different types of cancer with it. It's over 90% effective. It's been out for a long time. Some folks have this idea that it's like a new vaccine. It's been out for over 20 years. And, the data is there to show that it is effective. And, we've even seen examples in other countries where they do a really great job of vaccinating and their cancer rates, like you said, the cancer rates are going down, but some countries are talking about eradicating cervical cancer, which is amazing. The ideal time really to get the Gardasil vaccine is when you're younger. And that's because it's really not an STI vaccine, as like some people think, right? This is
Yeah,
a cancer prevention vaccine.
yeah.
So it's best to get this vaccine before you're ever exposed to the virus. So this
Right.
is why
Like we were
when
talking
people,
about, you were saying it's like so many folks are exposed to it. It doesn't matter who you are. It doesn't have to be a certain kind of sexual activity. It's like really everyone does get exposed to it. And that's why it's so important to, get it to people when they're young.
yeah, absolutely. And, so the window that we really hope for is before the 13th birthday. That's pretty much the goal. And we start vaccinating at age 9. And so if you're getting it at this sort of ideal window, it's only 2 doses because younger folks tend to have a stronger immune response.
Right.
Um, so it's 2 doses if you're getting it when you're younger, and then it is still approved though to get when you're older. So it's FDA approved through age 45. Um, so
We
you
do
can
see
still,
patients come in who have started to have that change on their pap smear, and they ask about it if they haven't been vaccinated. There's actually some good evidence that can cause regression of HPV in people who already have it. So it is really just like if you're somebody who didn't get it in childhood, it doesn't mean, that there's not the opportunity to get it. And I do hear that question a lot for some of my older patients.
yeah, that's amazing to hear about even having some regression with the vaccine. I always tell folks, we call it Gardasil 9 because it protects against 9 of the most common cancer-causing strains. And, I always tell folks, even if you've had 1 or 2 strains of HPV, chances are you haven't had all 9, right? So there's always going to be some added benefit. Um, and so I tend to not discourage folks from getting the vaccine, even if they are up to 45, depending on their situation. But if you are older, then it jumps up to 3 doses, which isn't really a big deal. It's just 1 extra dose. But that's simply because the older you are, the less robust the immune response is. So that third dose kind of gives you that added layer of protection.
And I think it's so important that you're talking about like that there's been this sort of conversation about like this is potentially an STI vaccine when it's not. And it's like it's actually a cancer prevention vaccine. And I think how we talk about it is so important. And I think this is also a time to talk in this current climate about the kind of rampant misinformation that's out there, not only about these
Absolutely.
types of things, but just about vaccine recommendations in general. And I think it's worth noting that these recent changes in the HHS vaccine recommendation language don't actually reflect a shift in the underlying science that we know about HPV vaccination. Like the evidence base is very strong. There's extensive data, that
Yeah.
shows high efficacy in preventing these HPV related infections. And in addition, like an excellent safety profile across like hundreds of millions of doses given worldwide. So, the benefits of vaccination hasn't changed, unfortunately. The messaging and some of the popular culture right now, or even from government, has, but really the science hasn't.
Absolutely. And, despite what the CDC has said, the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, New York State Department of Health,
Right.
all these folks have come forward and basically said exactly what you just said. This is an apolitical thing. The science has not changed. Let's stick to what we know and what works.
And
Uh,
obviously, we recommend that you come talk to us, book an appointment with us at Planned Parenthood. Like, it's really encouraged to speak with a provider.
yeah.
We're always here to answer your questions and help, make decisions for you, and, the decisions that are best for you. And it's always, given all this, like, all this misinformation, the climate, it's really great to talk to a provider in the community. I'd love to know a little bit more about the resources that you offer as well.
Yeah, yeah. I mean, absolutely. We always let folks know that they should talk to their primary care provider. If they don't have one, we try to help them find one because that's so important just to have that continuum of care. Planned Parenthood is always there for you. There are federally qualified health centers on Long Island and I'm sure in other parts of the state. But something that's also good to know, especially when it comes to this vaccine, is that if you are over 18, you could even just go to a pharmacy and get it.
Correct.
If you've spoken to folks, if you've gotten your information, you've spoken to your doctor, and you just can't get back to the office, you could always pop into a pharmacy and get this vaccine as well. And then, as far as payment goes, all major insurance companies are going to cover this vaccine. But there are programs through the Department of Health. There's the Vaccines for Children's program that if children are uninsured or underinsured, they can get their shots through the Department of Health. And there's also one for adults as well. So if you're underinsured or uninsured, you could definitely reach out to your local health department. And then Merck is the pharmaceutical company that makes the Gardasil 9 vaccine. And they have a really great program too called Merck Helps. And so they are able to foot the bill for folks that are uninsured or underinsured who are not able to get the vaccine otherwise. So we've done some work with that we have a clinic for uninsured patients. And so we've been able to use that program and it's been really helpful.
Amazing. I mean, I'm learning a lot too, so it's been great to talk to you on our HPV Awareness Day. Thanks so much for the work that you do. I'm really happy to be able to have this conversation with you today.
Yes, thank you. And it's been so great to meet you and thank you for all that you do.